Problem here is healthcare fraud. It is costing Americans billions and billions of dollars every single year. It's the reason that our healthcare insurance premiums rise every year. It's the reason that Medicare and Medicaid are draining the Treasury. And the bottom line here is that even though in Washington we're hearing all this talk of trying to contain healthcare costs, little attention is being paid to the issue of fraud. Teresa Langlois knew her podiatrist was cheating Blue Cross Blue Shield of Michigan when she read her insurance statement. Dr. Jeffrey Cook had billed thousands of dollars to surgically remove dozens of warts when Teresa only had a discolored toenail.
It was like robbery. I mean, they were overcharging for a procedure that wasn't done.
Teresa called Blue Cross, which investigated, ultimately leading to the arrest and imprisonment of podiatrist Jeffrey Cook. Healthcare fraud perpetrated by doctors, pharmacists, even organized crime gangs is rampant. A Senate investigation found Medicaid in recent years paid nearly 500,000 claims to people posing as doctors who were dead. Such fraud costs every American. It drives up prices for medical insurance, treatment, and drugs.
I think it's just a domino effect that ends up with the consumer. Somebody's got to reimburse for it. Somebody's got to fund that. And ultimately it gets passed down.
That's why major health insurance companies have special investigations units to weed out fraudulent claims.
We want to get that money back.
Falduto and other investigators estimate fraud accounts for a minimum of 3% of all healthcare spending, $72 billion a year. Other experts say the figure is more than 3 times that, topping $200 billion.
If we do not reform health care, your premiums and out-of-pocket costs will continue to skyrocket.
President Obama warns health care reform is needed to get medical costs under control. But one of the biggest culprits, fraud, gets little mention in the congressional reform effort.
They are certainly aware of this problem. They don't seem to know the magnitude or the seriousness. They don't seem to be acting with the kind of urgency that I would like.
The health reform bill approved in the House, 1,018 pages long, devotes only 40 pages to the issue of fraud. It and bills in the Senate would add $100 million a year to combat fraud, waste, and abuse. That's the amount of healthcare fraud occurring in this country every 12 hours, using the most conservative estimates. That level of corruption is a big reason that healthcare bills keep on rising. Now, of course, the big push in Washington right now is to provide healthcare coverage for those who don't have it. But experts say unless we pay more attention to fraud and attack it more aggressively, it's going to cost Americans billions more than needed in order to provide that insurance to people who do not have it now. Reggie?
Well, at least for this discussion, for the bills that are being considered right now, since they haven't been completed, is all hope lost, or could they possibly get more pages in there that would deal with this important issue?
Well, I mean, clearly the debate is not finished. The House has passed a bill. There's 2 committees in the Senate are still working on theirs. So we don't have a final health care reform bill just done. But as we reported, it really has not gotten the focus of the attention here. And it really is something that needs so much more money to attack it. We mentioned the figure, $100 million in the House bill. That is just such a drop in the bucket compared to this issue when we're talking about hundreds of billions of dollars.